Okay, good evening, everyone. Welcome to another exciting night with Sequoia Lending. So last week we introduced this wellness program, and guess what, guys? We received our first proposal yesterday. First proposal. Hey, it's a good start. 5 employees, but more to come. Obviously, there's a lot of excitement out there. A lot of people are very interested in about this program, and there's a few of heavy hitters actually coming onto our platform, try to partnering up with us. So again, it's a good thing. Definitely, this is the right product for us to promote this year. So tonight, we are going to be talking about how do you talk to employers. How do you sign them up? How do you do the marketing? How do you approach them? Whether I'm sure that you will run into clients that is only like 2 or 3 employees, they are pretty easy to talk to. But also you will run into corporation that has hundreds, if not thousands of employees. So how do you handle all those people? Okay. So tonight, Will, the expert, is here to talk to us. How do we market all those people? So Will, without further ado, the floor is yours.
Well, good evening, everybody. Hey, what a blessing to talk to you again. I see a lot of familiar faces, and so let's keep this kind of nice and easy flowing, if you will. And so what I'll do is I'm going to share my screen and use the slide deck, and then let's talk about how we would market to folks. Okay. So here's what I will tell you. This is a really complex sounding plan, but I believe less is more. Okay, and I think you'll agree that less is more, right? If you give them too much information, you'll shut them down. So let's start with a couple of release statements, and then this is how you're going to get a for-profit, nonprofit, public, or private sector company to engage at least enough to get a discovery call. As low as or as little as 2 W-2s, 30 hours or more. Now, those 2 W-2s can't be the owners unless they're a C corp. Okay, if they're a C corp, then the owners can participate as well. So you can have 2 employees as long as and the owners can be participating as long as they're a C corp. Okay. Um, First release statement. Whatever we talk about today is at no net cost to your business. So I'm going to go concepts, and then we can worry about wordsmithing, right? So that it works in your style. But the first concept, it is no net cost to your business. Number one. Number two is we don't replace a single professional that serves your business. Okay. And then we're going to put the 5 bullet points together and let's figure out some words that will work for you. Number three is we don't replace your employer paid benefits. Employer paid. That could be health insurance, dental, vision, disability, life insurance, right? Any of those plans. Or let's say they don't offer any health insurance. We can help them because we're not here to replace anybody's employer paid benefits. Okay. Number four, and this is the clincher. This is the one that I use all the time. Imagine if you could add more benefits without replacing your current benefits, without replacing your current professionals at no net cost, and it'll bring you net positive revenue. So all the folks on the line right now, if you've ever worked for a company where you were W-2, do you think there's ever been a conversation where it's benefits and net positive revenue cross-pollinate? Never, except today. Today's the day. Because this program is going to bring them net positive revenue without replacing their current employer paid benefits, without replacing the professionals. There's no net cost to them. And then here's the last piece, fifthly or lastly, your employees will end up with extra benefits, Aflac or colonial style benefits. So anybody here on this line familiar with Aflac benefits, you're going to get Aflac or colonial style benefits. But traditionally, employees pay 100% of those costs, and they have to qualify based on health. What if they didn't? What if they could have access to those benefits, no reduction in their take-home pay, and no health questions? So I'll pause. That's a lot of words, right? But we're recording this, right, Alan? Yeah. So that's the concept. And then let's figure out, what's the quickest way to get someone to the table without having to give them brochures or some slick, pretty marketing. Anybody have any ideas or questions or comments on that? I'll help you with it. Right here. Okay. So if you know the size of the company, right? So I'm going to say all those words. You can put it in a really nice format, and I could do it in less than 30 seconds. But then, and it looks like Mo, I've got Mo right in front of me. I can see you. New York Yankees has. All right, Mo? All right. So Mo, just want to let you know, your 100 employees on your company, no cost, no replacement of your professional. I'm not replacing your paid health insurance or your paid benefits. I'm going to put net positive revenue in your pocket, and your employees will get access to extra benefits, no cost to them, no health. And then let me show you what's in it for you. So Mo, just want to let you know, whether you decide yes or no, it's going to be the same cost, which is zero. But I'm going to reduce your work comp payroll on your 100 employees at $14,500 a person, or 1.45 million in work comp payroll at no cost to you. You get to keep your broker and policy. I'm going to reduce your FICA payroll taxes at 100 employees at $630 per year, or $63,000 in overspend of FICA. I'm going to put that back in your pocket, and you can do whatever you want with that money. You buy farm equipment, a copier, key man, buy, sell, executive bonus package, keep the money, whatever you like. And then we're going to give your 100 employees about $120,000 worth of extra supplemental benefits. They don't have to pay for it, neither do you. And there's not a single health question they'll have to ask, and they can cover their family, which will help you attract and retain employees. And again, we don't intrude on what you already do. Would that warrant a 15 to 20-minute discovery call?
Absolutely.
Here's the great part about it is, in 5 minutes, you can say no, and it'll cost you the same as if you say yes. Or it's a corny phrase, but you can hire me. You can fire me before you hire me. It'll only take you 5 minutes to find out. Because remember, I'm not changing a thing. I removed a lot of roadblocks, correct?
Yes.
Right? Because I mean, in your mind, any salesperson that tries to approach you about anything, right? You're thinking, I already have that I already have it covered. We're good. No. You know what? I've got someone, or I don't, what are your rates? Look, it doesn't matter what you've got. I'm about to hand you freed up money that you're not used to, or you're not sure about. And I'm not going to replace anybody that is in your Rolodex. And your employees are going to end up with more benefits. And I've removed two of the major roadblocks: cost and health questions. Any questions or comments that I can answer? Sounds too good to be true. What are some other objections? Yeah, you know what? Can you send me a slick? Well, we have an actual editable sheet.
Too technical. Give me here, Mr. Ram.
Oh, we have an editable sheet where you can go in and just put in your name and the number of employees. It'll do this math for you. So then this way, like, doesn't matter who I'm working with, right? It could be 8 employees, 1,200 employees, 87 employees. And I put this in front of them. And then I just tell them, hey, look, an email quick, or call them. Hey, no cost to you. Would you like to at least find out why? Hey, after 5 minutes, you'll know if you want the next 15 minutes after that to be spent, right? It'll be worth your time. It's $0 either way. But I'm going to put money in your pocket when it comes to benefits, and even your health broker and anyone else that's serving you is not going to give you that opportunity. But today's the day. Questions, comments?
Yeah, well, what is the typical objection? Is it in this line, in this business, would it be the actual time to speak to them? I don't have time for this.
Yep.
I don't really, trust who you are. what's the typical objection and how do you handle it? What's the rebuttal?
Yeah, it's a great question, right? Well, first of all, time, totally agree. Here's the thing though. Remember earlier I asked you when it comes to benefits and net positive revenue, have you ever experienced that?
Yes.
Well, if you've never experienced it, I can show you how companies all over America are experiencing that. And here's the good news. It'll cost you the same if you say no or yes. And then after 5 minutes, you'll know if you want the rest of the information. I promise you. But usually that never happens. No one's ever stopped after 5 minutes. Because think about it, I'm going to hand you free money that you're already spending. We're not going to charge you anything for it, net cost. And we're also not going to replace anybody that does anything for you. And your employee's going to end up with more benefits and no cost to them and no health questions. I mean, I think you'll know after 5 minutes if you don't want to keep on proceeding with the conversation, right? So say, look, you know what? I can even do it in a quick 10 to 12 minutes. It's just a discovery call so that you can see if it actually makes more sense to maybe even schedule more time, right? But you'll know. Actually, I used to make a joke, which is if you decide no or yes, I'll charge you 100% of zero. I'll even send you late fees.
I have a question.
Yes.
Okay, I have a question. Because I just kind of joined. I was trying to get in and I tapped into the wrong meeting. All right.
Oh, no, you're fine.
Yeah. So I was just trying to. It sounds like you're offering employee benefits, and I just want to weigh this against something that I already do. In terms of being able to approach employers, and at really no cost to them, they're able to get tax credit for offering their employees health and health insurance and life insurance, and they get tax credit on each employee that they are able to service for that client. Is this that?
It is. It is, and yet, and then it isn't. So here's how. Let me show you what it actually is. Okay.
Mm-hmm.
So the reason why we don't replace their employer paid benefits is because the program we're offering works in conjunction with whatever health insurance the employer has or the employee has independently or through spouse or they're on Medicare or even if they don't have health insurance. So this is a wellness or preventative healthcare management system that works in conjunction with your health insurance. 24/7 coverage, unlimited usage, no co-pays, no deductibles, insured spouse and all children up to the age of 26. So I'm going to ask kind of a silly question, but if your son or daughter broke their foot, would you take them to the emergency room?
Yes.
But you understand that that's not an actual real emergency, right?
No. If they broke their foot, I'm probably going to consider that an emergency, but I'll go with the flow.
Yeah, but you're going to understand the human condition piece on it, and here's why. So my son or daughter breaks their foot, and then I go to the emergency room, and let's say I've got health insurance, and it doesn't matter if it's strong or weak, you will be exposed to some out-of-pocket costs, correct? Co-pays, deductibles, co-insurance.
Yes, especially if it's like a urgent care.
But I mean, I'm talking about like an emergency room in a hospital, right? So if you go there, you're definitely going to be exposed to some emergency room kind of costs. Do you know what they'll charge you for the x-ray? You have no idea. So this program is an app that you'll either hit the call button or text, and they'll know who you are, and they'll ask you what is you or your family's current medical or physical and or mental health situation, and you're going to say, you know what, my daughter broke her foot in a soccer game, and I'm going to the emergency room. And they're going to say, well, based on your insurance, though, you realize you have not hit your deductible. You're going to experience a very large bill for something that can be treated for a lot less cost, less time, less usage on your company's health insurance or your health insurance.
So is this like a supplement?
Well, it's actually a navigation tool. So what they're going to do is they're going to work with you and say, okay, well, first of all, can we triage it virtually? And then whatever they can't do virtually and it goes outside of the virtual environment, they're going to quality and price source it in real time, 24/7. So it was Andrea or Andrea, correct?
It's Andrea. Yeah.
Okay, Andrea. Yeah, I had it was one of the two, right? So Andrea.
Right.
So they're going to say, Andrea, we've pinpointed a place that he can either takes your insurance or is going to have a lesser out-of-pocket cost with the same value care. It's a mile away at an urgent care center or an x-ray center or an outpatient center. And we'll source it for quality and price so that you're going to not have to encounter a very large bill. Because you have no idea what that bill is going to look like. And it's because hospitals and emergency rooms and healthcare, they don't post their prices.
Right.
Right? Like a McDonald's, right? And so, and then they can write prescriptions of any kind. They will give you mental health services, regardless of your insurance, anytime, from all the way from therapists all the way to psychiatrists. And then they'll write the prescription for you, and then they'll make it easy. Let's say you're trying to pick up a prescription at 7 o'clock in the evening after work at the CVS, right? The problem though is, what if they're run out of your formula? Well, your doctor's not even in the area. They're not even open. You just hit this contact and they'll get the right kind of doctor to write that prescription, and you can literally wait, and then they'll just give you a different formula or generic version, but they're going to work you through the whole entire process so that it's less cost, same high value care, less usage, less time.
Okay.
What
Is
if it
this
is?
regarding?
Go ahead.
Yeah, I was gonna say, is this a multi-state? Does it have a multi-state
Oh, it's
attachment to it?
50 states, unlimited
Okay.
usage, 80 languages,
Oh,
24/7,
okay.
no copays, and no deductibles. Matter of fact, let me pull up. So yeah, it's great questioning, and the reason is, Mr. Robinson, I see your hand, and I will definitely answer. Just give me 1 second, okay? So they have mental health services of any kind, at any time. You don't even have to make an appointment. They'll even allow the employees and their family to do their chronic disease management through the system, get them a nutritionist if it's diabetes or heart health or whatever it is, check their cholesterol, check up on them. And then if it goes outside of the virtual environment, they will quality and price source whatever your treatment is, and then give it to you in real time, and then follow through to make sure that you've got the best resolution for the least amount of cost. Virtual urgent care without actually making an appointment. Weight management, addiction recovery, smoking cessation. We also have patient and billing advocacy. So I'll give you an example. If you've ever encountered or been exposed to a doctor or hospital bill, how do you know the bill you just paid is correct? Well, we know because we have professional bill coders that will take a look at your bill before you pay it and let you know if there's any errors, if it's 100% kosher, if it's fair practice rates, maybe even negotiate that bill down. And then they'll explain to you what the bill is, how it works, so that at least you understand what you're encountering or what you should encounter.
Okay, so they have people that understand the ICD-10 codes that can look to see if that matches what they're charging you for.
Correct. They have
Okay.
professional bill coders, CPT codes, but also they have doctors of every kind. They even have dentists
Okay.
that'll give you a second opinion, so that if you go to your dentist and let's say they tell you that your kid's got 3 cavities, how do you know that they really have 3 cavities? Take the x-rays and the plan and then get through here, and then this dentist will give you a second opinion. And if it matches, great. What if you tear your rotator cuff and they ask you to get an x-ray or an MRI? How do you know that x-ray is even needed? Well, we go here and they have orthopedic surgeons that'll do a peer-to-peer call to actually confirm that x-ray or that MRI is needed. But then also, where are you going to go? Well, let's quality and price sources that as if you were on Amazon. Well, do I buy it here or do I buy it here? If it's the same quality and for less cost, I'm assuming most people are going to pick less cost, right?
Right. So is this what is this then? Is
This is
it insurance?
It is a preventative healthcare management program with an emphasis on wellness.
Okay. Yeah, it
And
looked
it
like a
works.
well.
Yes, ma'am. And it works in conjunction, though, with every plan that someone has, whether it be strong, weak, even if you have no plan, right? If you tell them, hey, I have no health insurance, well, then they're definitely going to help you avoid any kind of hospital or doctor visit, right? So they're going to make sure that to send you to the least cumbersome, least costly resolution for you, right?
And what does the employer pay for this?
Net,
And
no,
the employee?
no net cost to either party. And I'll show you exactly how that works. Okay.
Okay. Mm-hmm.
Yeah, no, it sounds crazy and it sounds a little too good to be true, but I'll show you
Well,
why it is.
no, I'm just trying to look to see because I'm doing something similar than this, but it doesn't have the GPS thing that you're talking about. So
Oh,
that's
well, then
why
let's
it's piquing my.
yeah. So let's talk about that, right? They have geofencing around every hospital in America. So let's just say that you're frantic because, like you said, I mean, if it's my kid, I'm gonna rush them to the emergency room, right? I won't even think about an app. And let's say you
Mhm.
just decide to do that. As soon as you hit their geofence, it'll alert you if your phone's on, and it'll say, Andrea, it looks like you're about to enter an emergency room. Is this a true emergency? Because you're about to encounter an emergency room kind of cost, or can you pull over real quick? By the way, we can write a prescription for her or his pain, but also let's guide you and give you a new navigation to the same resolution, less time, less cost, less usage on your health insurance. Pretty brilliant.
Okay.
Unlimited.
Yeah.
Mr. Robinson, you've been waiting patiently, sir. Jesse Robinson II.
Good evening,
No,
Alan.
I'm done.
Oh no, and I'll answer more questions if you have them.
Good evening, Alan. Good evening, William, and rest of the Sequoia family. Hope everyone's doing well this evening.
We are, sir.
I have a couple questions, so just be patient with me, William.
Oh no, take your time. Yeah, this is what this is for.
Gotcha. So correct me if I'm wrong. When it comes to businesses and nonprofit entities, they have to have workers' compensation if they're operating in a commercial real property, correct?
Correct.
Okay. So do you think that it makes more sense since they all have workers' comp insurance ready? Do you think it makes more sense to locate a worker comp broker, explain to them about Sequoia and this product? And since the brokers already have a relationship with their clients, they're already providing a service to their clients. Do you think it makes more sense to reach out to the brokers, tell them about Sequoia and the product, and then bring them on and then use them to reach out to their clients already and let them know about their service? And then us as Sequoia agents, we just collect the overhead of the work that they're already providing for it? Does that make more sense?
Well, it makes a lot of sense. But you know what? Actually, that works for any kind of professional that has a book of business. And so let me show you. I'll go back to the presentation and I'm actually going to address that, Jesse, okay?
Okay. Because I know you said that say less is best, right?
Yeah, well, here's the thing though. Every company, so let's talk work comp, health broker, 401k specialist, a technology guy or lady, So here's the thing though. We can reduce work comp by up to 30% in some states, and they get to keep their broker and policy in place.
Right.
Well, I'm not even a work comp broker. So if I'm talking to a work comp broker, I'm like, if you could reduce work comp 30% and you get to keep the same policy that you have in place, well, you're doing something other brokers in the work comp space are definitely not doing it. Would you agree?
Agree.
Yeah. Well, here's another thing. We solved some other problems. 70% of work comp claims happen on Monday morning. I'm not a work comp broker, but if 70% of work comp claims happen on Monday, we've got a way with this program to mitigate Monday morning work comp claims. And here's why. People claim Monday work comp claims. When you get hurt off the job as a W-2 employee, you know for a fact 100% of your health bills, whether you have insurance or not, right? Your co-pays, co-insurance, deductibles, out-of-pocket, network, all that is on you, correct?
Yes.
In most states, you will have to do all of that while paying your current bills with zero or very little income coming in. That's a fact. It has zero to do with an opinion, right?
Right.
So let me ask you a question. If most folks are check to check in America, How do you pay new bills, current bills with no money? That math doesn't compute, right?
Right.
Well, did you know that we can give every employee an off-the-job disability policy and an indemnity policy, like an Aflac style policy that pays cash? The employer doesn't pay for it. The employees don't pay for it out of their paycheck, and there's no health questions. So even though I'm not in the work comp space, I just mitigated Monday morning work comp claims because I gave the employee and the employer a path of least resistance that's different than the one that they might choose, right? Because if you're in a desperate situation, that's why people claim on Mondays. It's not because they're trying to be unlawful. It's just because they don't have the resources. So let's transfer the risk over to us. No cost to you, no cost to your employee. So, Mr. Robinson, you're correct. But here's the reason why this is attractive to any kind of broker of any kind of industry. Because in sales, and I'm doing this for 23 years, voluntary benefits, as a salesperson, when you go to your client in a company, you're asking them for money for services rendered, correct?
Correct.
I go to the company and I say, for services rendered, I'm going to hand you money.
You got my attention.
Yeah, wouldn't you say that's different? Well,
Yes.
let's just say you got 100 employees, and I'm going to hand you $63,000 of FICA payroll tax relief, and you're the 401k broker, or they want an executive bonus package, or they want to do buy, sell, or key man, or put in more of their 401k, or buy that office equipment, or the copier or the farm equipment. Well, didn't I just kind of help them buffer that cost?
Absolutely.
So, by the way, you want to go get folks that aren't novices, obviously, in their business, but secondly, they've already got leverage in their community and they've got a book of business. And then we go partner with them, like you said, to give the employer more for less. And then you can recycle that money that we just saved them into the things that you want to focus on. And that's everybody on this call. I mean, whatever your core competency is, you can hand them money in something that you're not an expert at. Then can you just recycle that money into whatever you're trying to sell them already?
Wow. Thank you,
And
William. I
here's the-
appreciate that.
Yes, sir. And here's the neat part about the whole entire thing. I saved a nonprofit $225,000 in California per year in work comp and FICA payroll taxes. And I'm not their broker. I'm not their accountant. I'm not their CPA. I'm not their financial planner. They'll never fire me. I'm so sticky.
Gotcha.
As a matter of fact, least obvious choice, when I first met them, I get moved up to the very top of the Rolodex because I just handed them almost 20 grand a month in net money. And I
Right.
improved their employees' welfare, helped their employees do more with a whole lot less. You see, in the attraction and retention of employees, right? Reduction on their usage on their health insurance, right? You see, we're solving a lot of problems with one root offer. So that's why I mean, like, less is more. I just stick to what I know. And then when we get into the discovery call, we can start figuring out how we really solve problems for them.
Okay.
Yeah.
Thank you, William.
Yes.
Hey, Will,
Yes.
is that are those savings realized? Are those realized savings within the first couple of months that they will actually see? And are those savings that's going back into their bottom line able to be used for things
Yes.
like marketing, or is it just what's on the menu?
No. So yeah. So it's we're gonna break it up into two answers. Okay. I'm gonna show you the employee savings and what they have to use it on, and then I'll show you what the employer savings is. Whatever they're not required to use it for anything. They can go to the
Gotcha.
casino. Okay. Sounds good.
Yep, got it.
So I'm actually going to go to the paycheck example. So here's the thing: we have the tax codes in every single state. And by the way, we're not replacing their employer paid benefits. So I'm going to give you an example of actually a call I had yesterday with a company that is out of Utah. They've got Utah employees, Nevada employees, California employees. They have 220 employees, which means they offer health insurance, correct? Okay. They offer health insurance, they pay for it. Then I asked them, well, do you pay for life insurance? Yes, we pay, $50,000 on every employee, which doesn't cost much. We even pay income protection. We pay a disability policy for every employee. Okay, what about employee paid benefits? Oh yeah, we offer vision and dental. They pay for it 100%. I'm like, well, would you offer vision and dental if they didn't have to pay for it? Because you're already offering it and they have to pay for it. So of course the answer would be you definitely would offer it if they didn't have to, right? Would you offer critical illness or additional life insurance where there's no health questions and they can cover them, their spouse, and their kids? So I'll show you how we get there. But the way this works is we pull payroll and W-4 info with no names or socials. And then I'm going to show you where the money comes from. Because someone asked, well, who pays for it? Where does the money come from, right? So I just want you to know, everybody, this program was indoctrinated with the ACA or Obamacare in 2013, page 33,161. Okay. If anyone's ever read War and Peace, that's 33 of those. I think War and Peace is about 1,000 pages. So that's how big that document is. It is IRS, ERISA, and HIPAA compliant. And so let me show you this paycheck on an employee before they participate in this program. No cost to the employer, net, and no reduction in the employee's take-home pay, okay? And please, feel free to throw questions in the chat, okay? So here's the gross monthly pay before taxes. $3,458. This is somebody that either has said no to the program or this is somebody currently before we even offer the program, okay? They make $3,458. So I'm gonna just use you, Mo. This is your paycheck, okay? Let's say you work at your company. Mo, you're making $3,458. There's no pre-tax deductions. Here's your taxable income. If you're in a state with state taxes, your W-4 will dictate how your payroll company pulls your federal and state, right? They withhold that money. And here's your company's matching FICA right here. You know that as owners of W-2 employees or of a company with W-2s, you must match whatever your employee contributes to FICA to the penny, okay? The total, by the way, is $264.53. The employee's total withholding is $575.60. And here's their net. So if I've got an employee in front of me, your company is offering you additional benefits that most employees in America have to pay 100% out of their paycheck, and they have to qualify based on health. But because of your owner and they care about you, they've got a program where if you decide you want to participate, which is on this side, your gross will be the same if you say yes or no. Your total withholding will be yes or no. And your net would be yes or no, the exact same amount. So that's why we have a 90% participation rate when we meet with employees, because you can either have $575.60 and send it to the tax people and have no clue where it goes and who they spend it on, or you can have $575.60 withheld, but because of some mechanism through pre-tax, you only have to have $372.52 of that money going to the tax people, and then whatever's left over right here, 20308, goes towards all those benefits like critical illness, cancer, vision, dental, life insurance with no health questions. I'll show you how we get there, but doesn't that make sense? So
Yes.
if I was in front of you, would you rather have 575 go one way or 575 go a different way? But at least it impacts your family and all these extra benefits. And the government allows you to pay less taxes so that you can have access to these benefits. But it's the same amount of money. So if you're in front of me and you say no, then you stay over here. And if you say yes, you're coming over here and you just get extra benefits. So it's called a self-insured medical expense reimbursement program. So the employee or the family is going to pre-tax $1,220 in a self-insured premium for that whole entire wellness app that we just talked about with Andrea. No one will do it. Not a single person in America that I've ever met is going to take a third of their income away for any reason. Would you all agree? That's just way too much of that wallet. However, the government says since it's self-insured and it's a participatory plan, there's an IRS code called SMRP 105.11 that allows the employer to pre-tax it and then reimburse it post-tax simultaneously in the exact same paycheck. Well, then that would be a wash, right? You hold it for a second, give it right back to me. It's the same money. It's not the employer's money, right? I take it out of here and then I give it right back. And it runs through every kind of payroll company. But here's where the magic happens. Let me ask you a question, all of you, since you're owners of your own agency, right? If you own a company with employees, whether it be 2 or 1,000 employees, would you rather pay work comp and FICA on this amount or work comp and FICA on this amount?
2,200.
Yeah. So would it be safe to assume that your employees would also be willing to pay less on federal, state if it's state taxes, and Social Security and Medicare as well on the same amount of pay?
Absolutely.
Yep. And so the government says, take 575.60 out of that employee's paycheck, but only send us 372.52 to the tax folks. Well, whatever's left over, they don't get to keep that money. It goes towards a menu of supplemental benefits. This is just an example. But if you have $150 put in your check, you don't get to keep it. But you can buy a short-term disability policy with no health questions. This disability policy covers off-the-job injuries, as well as any illness, including COVID, the delivery of a new baby, cancer, kidney stones, appendicitis, whatever. How about critical illness with cancer for your whole family, regardless of your pre-existing conditions? And you don't have to use your money to do it. You can go ahead and pay for it right out of this allotment. So imagine if you're in a restaurant and someone gave you a $150 gift card. How would you spend it? However you wish. And by the way, if someone gives you a $150 gift card, the likelihood is some people will go over their allotment. Agreed? Happens all the time. And you can do that. I can buy a hospital plan. Maybe that helps me with my deductibles. I can buy an accident indemnity policy. I can even buy life insurance, whole or term, without any health questions. The whole policy obviously builds up cash value, and I can cover me, my spouse, and my children. And then I can even add vision and dental. There are a lot of folks on this call that wear glasses. So let me show you why that's huge. And that's why it doesn't matter what the company has. Here's what I always ask them. Do you offer vision and dental? Let's say the answer is yes. And it is employer paid. Okay. Has anyone ever had a vision plan here on the phone, on the line? Does your vision plan cover all of the costs? What if you had a supplemental vision plan that could pay on top of it, and then it would lower your costs out of pocket, potentially maybe even down to zero, and you could use it with any other vision plan? Or dental, same thing. Does your dental plan pay 100%, 60%, 80% of the cost for a root canal or a crown? Well, what if you had a plan that paid on top of it and it got you closer to 100% payout? Would you do it? Especially if you could use money that's already earmarked for taxes? You see where I'm going? And if it's employee paid, well, heck, well, we'll be the heroes right now. We'll go in and give you a vision and dental plan, and you just pay for it right out of this allotment. So I'll pause to see if anyone has any questions up to this point. And go ahead and just bring them on, because I want to make sure I answer every question possible. Oh, that's a great question. Andrea said, do you have to be licensed in the state you offer this in? And if you're licensed, as I am, in multiple states, what's the comp? Well, there's no comp on the actual insurance, but there is comp. And then I'll let Alan address that. But the comp is a per employee, per month amount on every employee, whether you're licensed or not. And it is in perpetuity as long as you keep it. We'll talk about that at the very end, if you don't mind. Anybody have any questions just about this piece that I just talked about?
So I have a question, because what I think is I like about it is the fact that you can get vision and dental, because when I look at other things that mimic this, they always say you have to get that separately, but they don't offer a contingency or a way for you to get that. Even though, you know, every one of these that I've looked at so far, 3 this week actually, are amazing. I'm liking this because of the fact that there's money left over to do that with.
Correct.
Yeah. So if I'm understanding correctly, if there's
Oh no,
anything left
you're
over,
100% on point.
okay.
And so that's why we're agile. right? Because here's the thing: every employee I've ever met, even if they make the same amount of money as their compadres, right? They've got different needs. They are where they are. Maybe age. Maybe they're a single mom. Maybe they don't have any insurance. Maybe their kid has a birth defect and can't get life insurance, right? Well, we can add children to the life insurance with no health questions. So it doesn't matter where they are. We'll be able to serve their needs. And then when we give them the money, well, as long as you know you have to spend it. But what if we cast a wide enough net on the benefits so that it fits anybody that we get in front of? Well, then guess what? The employees will keep it longer. Our PEPM that we get paid in perpetuity as long as they keep it. And then the employer, by the way, is happy. And the employees come back and thank you. And then we go back to the employer and give them the results, which is more savings for them, more participation, like 90 to 100% sometimes. And then your referrals will come without you even asking for them. I don't ask for referrals anymore. Because when I'm done and I deliver them the results, they just go, hey, look, you know what? I know a couple of folks. Can you work with a company that has 5 employees? Or can you work with this association that has 100 businesses? Or hey, can you work with my church or a nonprofit? Yeah, as long as it's got 2 employees, W-2, 30 hours or more, they're not the owners, I can work with anyone in America. So can you.
So let me jump in, touch up on the compensation. So again, first of all, it does not require anybody to have any license for this particular program. Okay, we are not making money on the insurance or whatever the profit or product is. We are making money on something called the PEPM, per employee per month, or short for PEPM. So our contract as Sequoia is that we are getting $20 per employee per month. So what you get, according to our comp plan, you bring in whoever that you bring in, you will get 46% of that $20, which is $9.20. It sounds little, but think about this. It does not cost any work whatsoever. The first offer, the first proposal that we submitted in, and in 24 hours, we have a proposal. We don't even need to go out there to present the proposal. Will's team and his enroller will go out there to talk to our client and explain to them what the benefit would be. They will do all the enrollment, and all we have to do just to put the client into our platform. So $9.20 per PEPM. It sounds little, but hey, this number adds up. So we are not just getting paid one time. Okay, we are getting paid month after month after month forever, as long as they stay in the program. So think about this. Right now, this month, you have 10 employees through you coming to the system. You are getting paid $90, not a whole lot of money. But how about next week, next month? That number adds up. But by the time you get to 100 employees, which is very, very quickly, you are getting paid almost $1,000 a month, every single month. What about you get to 2,000 employees? Now you add up the number. Now you're not only doing this thing by yourself. How about you build up a team of people that do this thing for you together? We pay up to 6 different levels. First level, we pay you 10% of that $20, which is $2. Your first generation, imagine that you have 10 people underneath of you and each one of them have 1,000 employees. You're talking about 10,000 employees on your first generation. You are overriding $20,000 a month, every single month. Think about this. So again, it's just the first generation. The second level is 5%. Third level is 3%. Fourth and fifth level is 1.5% each. Sixth level is 1%. So again, all these small number adds up. And the thing is that there's no reason for them to get out of the program. So as long as they stay in the program, you will continue to get paid.
Yeah, so let's talk about that, right? Keep this in mind. You get to stay on your core competency and your core business. You don't even have to be an expert. Someone else is going to execute it for you. You don't have to have inventory. You don't have to actually have like superior knowledge, right? You just have to understand kind of how to get the company to us. And then we execute the whole entire thing. And then you're going to keep on getting paid. And here's the thing though, 1,000 lives, 2,000 lives, about 5,000 lives, about 10,000, right? And the thing is, here's the other piece. You're only 2 handshakes away from somebody you want to know. So I'm going to give you a quick example. I'm really not that big a deal. However, I'm about to meet the mayor of one of the largest cities in America just through one extra connection, 2 handshakes away. I have no business meeting this mayor, but because someone liked this, right, and then introduced it, and then I meet with a union president, and he's like, "This is great. I'm best friends with the mayor because she used to be the chief, and she also used to be a union police officer, and she's going to want this for the city and the employees." They have 8,700 employees, and they have amazing benefits. They don't have employee paid benefits that are 100% paid by someone else. You see the opportunity? That's just one case. Or you can go 100 or 1,000 cases, 25 employees each. Owners of 25 employee groups, they say yes in less than 20 minutes from meeting us. Why wouldn't they? Most folks don't even pay attention to companies of 25 employees or less. Would you agree? But they also don't get access to the same rates and the same kinds of coverage. We're giving them Facebook, Google, you know, type benefits, but we're bringing it down to a company of 25, 2 employees, 8 employees. And so those numbers, they add up. And here's the cool part. You're still working on your core business. This is just mailbox money, but it could be huge. And so hopefully, so Alan, thank you for that. Anyone have any questions? Yes, sir.
Yeah, let me jump in also. Again, last week I mentioned that we as Sequoia, it's actually sitting on the financial coach seat for an organization called MBDA. MBDA, Minority Business Development Agency. Now, also, I share with you how to get access to MBDA and how to call the MBDA office. And guess what? I'm not sure if Mr. Turner is in the call today, but he did make a call. And guess what? The director of MBDA for Texas, interesting in the program, set up a meeting with Mr. Turner and myself on next Monday. Now, I don't know if you know the magnitude of MBDA. MBDA is a federal agency. It's an agency that helps minority businesses to get funding and to get benefit. They don't even know this thing exists. So when Mr. Turner presented an opportunity to MBDA, and they are drilled, they want to talk to us. So once they understand what we are trying to do right here, they will connect us with all the businesses that is in their pipeline. So Jesse, you mentioned something about talking to the broker. Now, that's absolutely right. Talk to the broker, but also utilize all these resources out there. Chamber of Commerce, MBDA, local nonprofit organization. A lot of these organizations are willing to help small businesses out there to look for funding and whatever that might be. So connect with them. Once you share with them that you are able to provide free benefit to their employee, they will listen to you. So again, there are many ways that you can generate leads, but I would suggest you to go to MBDA first.
Well, and here's the neat part about it is, right? It doesn't matter the industry. Just think about it, right? For-profit, nonprofit, public sector, private sector. Lots of benefits, no benefits, right? Union, non-union. That city, by the way, has union employees and non-union. And here's the neat part about this. Union employees have access to it because this is not part of their collective bargaining agreement. This is not a union negotiated benefit. And so that's huge. There isn't anybody that you can't help. I mean, it could be all the way from your auto mechanic to a barbershop that's got W-2 employees, all the way to your favorite restaurant or chain of restaurants, a chamber, an association of businesses. Now, we wouldn't sell to the chamber, but we could sell to the chamber that has 300 companies and have them sponsor it. And then they lead us to 300 of those chamber companies because now the chamber is bringing some kind of value, right, for that chamber membership. You see where I'm going? And so it is huge. And the difference is we're going to give them something that no one is doing for them. No one, not a single one of their professionals is bringing them money and then solving problems and then making it easy for them to do it. And then also impacting their biggest assets, which are their people. It's not even their product. Their biggest assets are their people, right? If you don't have good people, it doesn't matter how good your product is. Questions, comments? Oh, Mr. Robinson, that's great. We're on the same page, right? Yeah. And so, yeah, we're gonna send you this video and you'll see the slide deck. I believe that it's this right here. It's this one pager. Because remember, no net costs. We're not replacing any professional that serves your business. We're not replacing your employee-based benefits. We're going to bring you net positive revenue. Your employees get extra benefits like Aflac style without having to pay for it, and there's no health questions. And then, by the way, when the rubber hits the road, this is what the biggest concern is. And someone asked about some of the objections. That was Mo, I think, sir. Here's one of the major objections once we get to the actual meeting. Their HR and payroll, they don't like benefits, really. That's their job, but they don't like it because they feel that there's going to be more work put on them. I can tell you it's the opposite. Because of our technology and the fact that we work with every payroll company seamlessly, and we have enrollers that meet with all the employees so that they're educated, the lift is actually minimal for HR and payroll. And because we're experts at it, we'll be able to do it so it's seamless and conducive to their work environment without stopping their business. And they love it. When we're done, they're like, yeah, this is not what we're used to. Yeah, and that's because we're uniquely different. Any other questions or comments? What's the tax code used for this program? Oh, great question. Let me show you that. It's right here. So we have 3 sets of ERISA docs that, and we do that at absolutely no cost to the business. One of them is a Section 125. A lot of you might be familiar. It's a cafeteria plan. If they've got a current Section 125, we need to amend it at no cost. And then we're going to add this code 106A to allow this plan to be pre-tax. Everything in that wellness app must be 213D compliant. So we'll give them wellness docs that state so. And then that reimbursement that allows the employer to reimburse after tax, it's 10511 K1 and K2 right here. And we have sets of docs to show them, to support the architecture. So if there's anyone on this line that does 401k or 403B or unreimbursed medical or dependent or any kind of tax kind of plan for a group, it requires ERISA docs to support that architecture. And so we're going to do the exact same thing and make sure that they're compliant 100%. Any other questions? Great.
Thank you. I appreciate
that. You're welcome, sir. It's my pleasure. So here's the good news. This is a partnership that is just going to be ever evolving. And so if you've got questions, you can take it straight to Alan. He's got full access to me and be more than happy to meet with you or meet with your client or meet with you before we meet a client so that you have more clarity. If you want to talk about strategy or what that looks like, we're here to help you do more for your clients and then get you paid at the highest value, right? And so we're here to help you in any way we can. Please feel free to contact Alan, and then we'll be more happy to answer those questions, okay?
Well, I have one more question for you, Will.
Absolutely.
When you or your team set up the meeting, is that a virtual meeting or do they actually have people around the country to meet in person?
Yeah, most likely it's going to be a virtual meeting, but then let's say we're going to enroll their employees. We have enrollers all over the country, so we can do enrollment on-premise, call center by phone, by Zoom, several different situations. But when it comes to the meeting, it's going to be a virtual presentation unless we've got someone that's in your area that can go in person. By the way, I prefer in person, but I'm in California. So if you need me to help your client, I'm pretty good at it. So I've been doing this for about 8 years, and I'll make sure that they understand with 100% transparency why it's a good fit for them, and I'll serve them with white glove concierge service. Okay.
Yeah. So when we get a candidate, basically the first step is to contact Alan, or is that correct?
Yeah. So yeah, we're gonna set up a really nice, easy flow for you and a process so that you're not going back and forth trying to figure out who's available. We have a calendar scheduler, so this way, when you're in front of your client, you go click. And you're gonna go, yeah, you know what? And it obviously takes care of all the time zones. So obviously, if you're in Florida and you're trying to set it up for, I don't know, let's say 12 noon, well, that's 9 a.m. my time. It'll know if I'm available at 9, and then you just go ahead and put it in, and it'll send out all the information, take care of all that. It's a very easy flow. But I do have to leave, and I apologize for that. But I appreciate y'all. I'm looking forward to talking to you. And just keep this in mind. There's not a single bad question that you can ever ask. Okay. So cheers to everybody.
No, yeah, go, but real quick question. Will
Yeah.
we be receiving information on this product and the links to do the calendar schedule?
Yeah, so Alan's gonna take care of that. All right. I'll coordinate with Alan to make sure that's a nice, clean, seamless process for you all. Okay.
Yep.
Thank you.
Cheers to
Absolutely.
everybody. Bye now.
Great.
Cheers.
Thanks, Will.
Bye.
Okay, well, again, it's already at the hour, so make sure that everybody, we have a lot of information on our YouTube channel. So I suggest you to watch the YouTube channel first. We have a smart presentation, so get yourself familiarized that with that particular video. And also before you when you talk to your clients, ask them to watch that also. It's about a 20-30 minutes video and explain it very, very clearly. And also, we are going to upload another video that we did this morning. It's in a detailed explanation how the proposal work. Okay, so that one is going to be online as well by, I believe, by tomorrow morning. Okay, so guys,
Hey, Alan, I guess I missed it earlier, but what is the name of the company?
it's called Well Solution. So that is Well's company. So he has a huge network of service provider that he provides services to. So we're partnering up with him directly, and we are using his platform. We're using his technology. So he showed me a lot of the technology that they have in the behind the scene, how they enroll the enrollers and the technology that they use, the company that they use. It's very sophisticated. And as a matter of fact, tomorrow we have another meeting with him and the CEO of the tech company to go over how secure that network is. So
is there a name for the wellness company that is implementing this product?
He has a lot of different type of wellness company that provides something like this. For example, like National Life, I don't know, it's a MetLife, and it's a lot of insurance company, a lot of wellness company out there that provide this kind of services. So basically, he's a broker that pulls in all these lenders to, I mean, not lender, that's what I'm used to call, all these service provider onto the platform to provide to different employees. So for example, my understanding is that, hey, let's say you work with a 10 different employee, you work with a restaurant that has 10 different employees, and different employees pays taxes differently. If you're single, you're married, you marry your kids, you're all different, right? So now based on how they pay their taxes, and now the system is going to match them up with various different insurance company, different type of service providers. So again, that is what his system be able to do.
Okay, so there's no actual name for the company. He just, okay, I guess I understand.
You're talking about actual name, you're talking about a service company provider?
Well, no, like what is Will's company's
Will Solution.
Will's Solution.
Will Solution, right? That's his company.
Okay.
And he has been doing this thing since 2017.
All right. Thank you,
Okay.
sir.
Is
Right, guys.
is that Well Solutions or Real Solutions?
Will Solution, his name, WILL, Will Solution.
Okay.
Okay.
Okay, thank you.
Yep. All right, guys. Well, thank you so much. And again, this month is going to be a very, very exciting month for us. Next week, I believe that next week we are going to have a fix and flip company to come to talk to us about 100% fix and flip program. So Mr. George Franco, he is one of our advisor. He is the one that is going to leading that training next week. The week after, guess who is coming online? I'm not going to tell you, okay, but it's one of the big heavy hitter in the real estate industry. If I name the company, you will know well, I'm going to name you. One big heavy hitter from EXP Realty is going to be on our platform 2 weeks from now on the 20th, okay, March 20th. He's going to talk to us about how to help property owners to save on their tax bills. So again, that is going to be huge for us as well. So ladies and gentlemen, that's all we have. Thank you so much for another great episode. And I see you next week. Take care.
Thank you. Bye.
Everybody on Friday.
Good night.
Thanks.